My name's Hansen. I'm one of the founders of Vector Health and Performance, and today we're just going to talk through some knee injury prevention. So there's lots and lots of research to talk about doing simple exercises can make a massive difference in your risk of injury. So I'm going to talk through the role of a couple of different muscle groups in preventing knee injuries and what they do, and then also talk about why you don't want a knee injury, and then talk about things that you can do, so practical exercises, and talk through some of the technique. And these are the little things that you should be doing every single day. And why we're doing this video is because when we go and do academy work with netball athletes or go and do work individually with athletes, a lot of the time we spend on teaching this basic methodology. And if you can start to do this at home, and then we can see you and you can do this basic stuff, then we can find ways to improve you a lot more rather than just focusing on injury prevention, which I understand a lot of people might think is not the glamorous part of being an athlete, but it's really important. So the role of the hamstring, so that's one of your biggest key area muscle groups to prevent knee injuries. So what they do is they stop hyperextension of the knee, so the knee joint flexes and extends, and it stops that, or helps stop hyperextension of the knee. So it provides almost a catching response when we're landing, so it doesn't let the knee pop into hyperextension. So when we're landing, we want to be able to cushion the landing with our quads, so to stop the knee collapsing, but the hamstring stops the knee from jerking back this way, and that's how quite a few knee injuries can happen. So it's primary knee flexion. So if you pull your leg back, that's hamstring. So that's what hamstring does. It pulls the leg back like that. And then most importantly, it acts, or it can support the role of the anterior cruciate ligament, which is one of the most important ligaments we have in our knee, and it kind of acts as a brace to help stop this part here, the tibia, rotating upon the femur as such, so that it doesn't, what's called a pivot shift injury, where essentially this has happened to your knee joint. So knee joint stuck in the middle, and then this is happening. So that's not really what we want, and it takes a long time to come back from those injuries. So that's why we're really passionate in trying to prevent them. So the quadriceps are another really big muscle group. So it's like your push muscle. So anything that you push off the ground, so jumping. So if I'm pushing, it acts as my knee extensor, so extends the knee. And it also acts as partly to help, so the quadriceps group help with hip flexion. So in running, that knee drive up, knee drive down. So really, really important in lots and lots of different things. So anything to do with jumping, running, turning, sprinting, anything like that, or in sport, then quadriceps are usually involved. And most people do too much on their quadriceps, and they don't save enough, they don't do enough on their hamstrings and their glutes. So that's something to think about if you're doing your own programming. It's really important. Alright, so then the glutes. So the role of the glutes is your primary hip extensor. So we're going to extend the hip like that. So think about running, hitting what's called a stance phase. So we're touching the ground, anything that's touching the ground, and then we push off. So as we push off here, so push off, that is your glutes. So that's the glutes working to extend the hip. Now, it helps also control knee valgus. So we talk about external rotation this way of the knee. So not letting the femur internally rotate on landing. So the glute med, so it's a muscle at the side of the glute here, that helps you externally rotate the leg and keep a nice straight line. Now with female athletes, one of the big differences there is generally going through puberty and maybe beyond into early adulthood, you get what's called a Q angle, which is essentially the angle where the center of the hip joint is compared to where the foot ends up on the ground. And there tends to be an angle like this. So, and then with some people it goes like this and then like that, so that from the knee joint you get another angle going that way. So we try to, in a running athlete, we'll try and modify that to make it safer for an athlete. But some athletes are built with an internally rotated femur, so that means that a lot of the times they're athletes like swimmers, like non-land-based athletes. So that works fine for them, but we've got to be still careful when prescribing exercise to them outside of that their comfort context. So athletes like rowers can be quite similar, so internally rotated, so they'll appear sort of pigeon-toed sometimes, but you can't try and reverse that out because it's not necessarily going to be advantageous for them. So the stability of the hip, the stability of the knee all interacts with each other, and that's what all of these exercises try to do. So they try and interact the hip, the knee and the foot and try and get you a better balance point on the ground and a better understanding of where your body is in time and space. Most ACL injuries happen, I'll say most, that I see happen what's called non-contact. So that means that there's no body contact, there's no one hitting you, no one trying to hurt you, anything like that. They happen just out of turn and run and something, your brain, your body not quite connecting, a big pivot and shift happens, and then all of a sudden immense pain, and then you find out you've ruptured the ligament. A lot of people say, but I was only just turning, or I wasn't doing anything significant. It doesn't have to be. And that's why the injury prevention research is so strong. There's millions and millions of dollars spent every year on trying to work out how we can prevent more of these non-contact ACL injuries. So research suggests that working on your glutes and getting them working better and getting them to interact with your hip and your knee better will have a massive effect. So if you just do some of these basic exercises but you do them every day, the consistency and the frequency to me is the key. It's not about how good or how hard you work, it's more about how you do it. So are you doing the right thing every time, even when no one's looking? So it's practicing 5 minutes a day. If you devote 5 minutes a day to this stuff and you're a jump and run athlete, then it's 35 minutes a week that you're going to be doing it. It's not that much time at the time you're doing it, but it's a lot of time if we add it up over a year. So I'll give you 2 reasons to prevent a knee injury. One is because you can't get better at something unless you're doing it. So if I can't let you, or if I can't make you do your sport, if I can't make you do the gym, I can't make you run and jump and sprint and turn and do all those cool things that we do in the S&C world, then you can't really get better at them if you're sitting on the sideline because you've had a knee injury. So that would be, for me, a younger athlete especially, or an athlete in their physical prime. When they do a knee injury, you're looking at a year off. So it's a long time to have when the body is at its prime, but we can't do anything with it. The second thing is cost. So you can look at anything from $3,000 to $30,000 and even beyond that, especially if you're losing work time. So the total cost, that's what it's sort of estimated at over the course of a serious knee injury. So we want to make sure that we're not going through that kind of financial strain as well. And then also, like the last thing is, obviously any injury, they hurt, and they're really frustrating, and they affect you in more ways than just physically. You're not being able to play sport for some people is really challenging mentally. So we want to try and encourage people to do the little things so that you don't have to be a passenger on the sideline. So then with this exercise, if you've got a current injury, illness, that is there, or a previous injury, illness that make it maybe less safe to do exercises that we're going to show you, then we encourage you not to participate in this part, but to go and find someone like a physio, an exercise physiologist, or a strength and conditioning coach that can help you work out what of these exercises is the best for you to do right now. And that really goes for anyone. Like, we're showing general exercises that you should be able to do and progress from. However, if you find them really hard to do, that's not your fault. It's just that maybe your body isn't built in a way that lets you do that exercise easily right now. Maybe your movement coordination isn't quite there right now because you're going through a big growth spurt. So it doesn't cost a lot of money to go and see someone to find out exactly what you should do, to get proper instruction, and then to go away with a plan. So you can definitely watch and learn any of this. And if you're a coach, working with your younger athletes especially, if you spend 5 minutes on every warm-up just doing these things and doing them well, the difference is maybe you can save that one knee injury that happens later on in their teen years. So we'll show you some progressions of different exercises, and we'll also show you some ways of making them easier for yourself and then harder for yourself. Alright, so we're going to get to the exercise prescription in just a moment. Alright, so the first exercise, it's called a 3-stage hamstring or glute bridge. So glute bridges are really common. often done relatively poorly when we see them for the first time. So we're going to spend a bit of time showing you this. They're worth watching for the first couple of minutes, and then go and try them, and then keep coming back to this. And remember the key points. Key points with this is keep your spine in a neutral angle, which means that how you stand is how you want to be laying down. You don't want to be arching your back or pushing your back hard to the ground. So keeping it in a neutral position. And then the focus here is doing it really well. If you can't do it well, go back to what you can, practice that, and then try again and try the progressions later on. So 3 stages means 3 foot positions on the ground, and progressively harder on your hamstring and less hard on the glutes. So we lay down on our back. So hardest way is having our foot, or 1 foot on the ground and 1 foot out. So like that. So you have to control, it's called eccentric strength of your hip flexor. So we're going to lower this down as we go so that you're going to do 2 or 3 things at once. However, we might just show you, for now, we'll show you the easiest way to do it so that you can get good at that. So we're laying nice and neutral on the ground, kind of relaxed. You want to think about tucking your foot here into your bum as hard or far as you can, so the most knee flexion possible. So then we're going to try and lift our toes off the ground, and then we're going to try and push up and down like that. So pushing up and down and keeping everything nice and stable through here. So you should feel your core working nice and hard to stabilise so that this hip doesn't drop down. So if this hip drops down, you start twisting on the ground, just put your foot gently on the ground and then push up like that so that this stays neutral, because that's what we want in real life when we're landing, and back down. Then that's stage 1. Should be able to do 5 at least on each stage before you progress. Then we're going to put our foot out at about 90 degrees of knee flexion there. Then foot up again, then hands on hips to feel, or hands on core to feel things so that this is working. And then we're going to push up and then down and up and then down. So this starts to work the hamstring more because it likes to work from 80 to 130 degrees of knee flexion extension. So it's when we're in here, we're taking the hamstring away from that activity. We're making it work on the glute. But here, we're working glute first and hamstring at the end. So we're getting it to combine. 5 on that, make sure it's well controlled, make sure you can do it. Then we're going out here. Now, when we're landing here, this is like landing. This is the angles that we use when we're landing and catching. So when we're here, these get tougher. So my recommendation is start with the other foot on the ground just as a support, and then up and then down like that. Then just adjust your foot to suit, like there. So as you can see there, my knee isn't really hard locked out at the end, and that's not what we really want. So then we're up like that, and then push, and then down like that. So you can see that if you have a lot of fatigue in your legs, this one will particularly be tough, and it's tough for most of us, no matter whether you're good at it or not. So pushing up and then down. So it takes a degree of concentration. It's almost exclusively your hamstring working in that context. And the key behind that is that if you can do that really well, the amount of force taken to do that exercise well, the amount of force taken to land, then you're starting to get towards the force of landing more. It's a really important exercise, and most people that we test won't get past stage 2 on their first go, which is absolutely fine. We want them to get to stage 3. So 5 of those each way, each day by 2 to 3 sets is what we'd usually prescribe, getting up to 5 by 5. So 5 sets, 5 different ways, or 3 different ways, 5 sets of that all in a row. And just doing that once a day is really useful in terms of getting your ability to coordinate your hamstring to work with your quad, to work with your glute. Alright, next one, single leg stance. So you should be able to stand on one leg comfortably for 60 seconds with being able to move this leg around, being able to move your arms around. You should be able to do that, especially if you're playing cord sports. If you can't do that, then you need to practice it. Practice that before anything else. It's really important, and it needs to be symmetrical, both sides. Doesn't matter if you're a left kick or a right kick, or you like your left leg more than your right leg, you have to be able to do it on both because you land on both. So make sure I'm just going to give you that as a target. So just be able to stand comfortably like this. So we use a bent knee, we use a bent hip. We'll load onto that leg. We don't just stand. You were given a knee joint for a reason. You're going to use it as a cushioner. So you're not just standing like a peg leg. You're standing with your knee, everything bent. It's much harder to do that for some people than others because of that Q angle. So if you find yourself doing this, like your angle there, you've got to find a way that you can do that. So often it can be just starting with that, in that little squat position, and start with a toe on the ground here. So out to the side, and just hold that balance there. And then think about this hip, so the non-stance hip, it gets lifted like that, which makes your glute work more, which then helps externally rotate your leg into a good position so that you can hold that balanced position. So that's your key, like just work on that. Yes, you can work eyes shut, but make sure you can get 60 seconds of eyes open before you worry about doing that. Alright, so next one's single leg squat. So we use these because it's eccentric, so lengthening under tension, loading, especially your quads. So from here, what we're looking at is a squat pattern. So on single leg stance, if you can't do single leg stance well, these are probably going to be too hard for you right now. So we'll show you a down progression from that. So we should be able to get 90 and 90. So 90 degrees at the hip, 90 degrees at the knee, and be able to do a good 5 to 10 of those with good technique. So you can see my knee, my hip, and my foot, it's all pointing in the same direction. So that's your first goal. Now, if you can't do that because your knee angle goes inwards and you can't balance, then foot out to the side, almost like a side lunge position, but just resting your foot on the ground, and then sit straight back. So you can see there that it encourages you to hold that line. So it's one of the progressions that we use for athletes with bigger Q angles, so with that bigger angle. And it helps you sit into that position, and we're holding about 20% of our balance on this side, 80% on this side. So down and then up. So the weight's centered through here, push, and this side just goes with that flow. So that's your second progression down. Your third progression down from that is here. A wide split stance, gets everything in a straight line, goes to there, comes back up. Again, being able to control it down, and then up with your hands in any position, being able to move your hands, move your arms, and hold this still, and move well through there. So that's your squat sort of progression ones that we'd like to see people be able to do better. So jumping, jump and land, really important is we're looking to keep straight line down through here. Some people struggle with that, but they're the people, like if that's you, people like us, we're for you, because we can help in terms of adjusting your landing angles. Landing with angles like that, that's the angle of a pivot shift that happens. So we want to try and avoid that. It's putting a lot of stress to this part of the knee as well, so it puts stress on your meniscus as well. So it's all about thinking about if you put your hands on your knees like this and hold that position, what that encourages a person to do, keep neutral spine, bend at the hip first, bend at the knee second. Glutes are the biggest muscles in the body. We want to use them to hinge and then get into that position to jump. So that when we're here and jump and then land, hands on knee here, you can see I'll come back to the same position I started at. That's the first thing we want to teach. So down, hands on knees, jump, land. And you can see that I'm not landing floppy, like I'm not going all the way into a squat, because we don't want to see that in jump sport. We want to see you be able to catch the landing. So using co-contraction, hamstring, quad, glutes, all working together to control the landing so that you can just be repeated. So then it's about jumping forward, sideways, backwards, being able to do that. So our progression there is giving people 6 jumps forward, sideways each way and backwards. So a total of 24 jumps every single day. You know, it wouldn't even take you a minute, but it's trying to get them done well. Start on the spot, jump forward, jump sideways, jump back. So that's one, you have to do that 6 times. You need to get that perfect before you start worrying about any single leg progressions. So if you can come to us like that, being able to do that, then you're already ahead. We can start working on the more complex progressions. We can start looking at performance improvements from there. Alright, so if you're at home and you're watching this and you've got a sore knees, hips, feet, you're the people we want to work with, especially, it doesn't matter how old you are, but you're the people we want to work with to help you be less injury prone, if you call it like that, and work with you to help design programs that work for you. So if you're sitting at home and you've got knee pain, and especially if you're a younger athlete with knee pain and you think that's normal, it's definitely not. So we want to help you try and enjoy sport more so that you can work harder when you want to. So that's what we absolutely love to do, is find someone that's struggling a little and make it easy for them, make it enjoyable for them, so you can go and do the fun stuff like playing sport. The thing that we struggle with, I suppose, is seeing the younger, especially the younger athletes and the athletes in their absolute prime, when we know that if we'd done the injury prevention work, the likelihood of having that injury would have been so far removed. So I can't encourage you enough, like the investment in your body, it's your vehicle, it's the thing that you use to do the thing that you love. Invest in that early so that you can enjoy yourself for a lot longer and then obviously not spend time in rehabilitation as much.